Jersey. I've been there since the year 1996, but I've had my own practice, Progressive Pediatrics, since the year 2000. I've seen lots of parents and lots of newborns. So today we're going to have a conversation about the experience that newborns are having in the hospital with their parents. So expecting parents as well as new parents, this talk is for you. And I'm joined today by Rebecca Four, who's a lactation consultant who's been practicing for a long time in Union City. Rebecca?
Good morning, Dr. Pollack. I'm very happy to be here with you today. Thank you for the opportunity. I'm a mom to a 15-year-old who I breastfed for about 2.5 years, and I've been a board-certified lactation consultant for 10 years and have been helping in families with breastfeeding for the last 15 years. I'm happy to be here with you this morning.
Exciting. Thank you for joining me.
So,
okay.
Dr. Pollack, I wanted to start us off by talking a little bit about what are the most important things you want parents to know about the first couple of days of life?
Gotcha. So if you forget everything else you hear from us today, I only want you to remember these few things. The next 30 seconds, remember them. We want you to feed your baby 8 to 12 times in 24 hours. Every 2 to 3 hours, the baby must feed. Each feeding session should be about 20 to 30 minutes of awake sucking time. If the baby goes on your breast and falls right to sleep and is not effectively sucking, that's not a feeding session, that's a sleeping session. And the baby can dehydrate like that. So please feed the baby skin to skin, tickle the baby until the baby is alert enough to feed for at least 20 to 30 minutes every 2 to 3 hours, and watch the baby's output. How much urine and stool is the best indicator that the baby's feeding effectively and is feeding well. The numbers that you should be looking for in terms of urines is the same as the numbers of days of life. So on day 1 of life, the baby should make 1 urine. Day 3, 3 urines. Day 6, 6 urines per that 24-hour period. If the baby's doing that, then the baby's okay and not dehydrating. But if the baby's making much less urine than I just suggested, then it's time for you to call me or Rebecca right away. Because if you don't, the baby can dehydrate and we can go down a different path that we don't want to go. The number of stools per day is somewhat important, but not as important as the number of urines. The baby can make anywhere between 1 and 10 urines, the number of stools, 1 and 10 stools per day, and that can be normal. But the number of urines is really important to watch out for. So that's the most important thing we want you to know today. So Rebecca, can you tell us a little bit more about what's happening at the hospital? Tell us about the parents' experiences. We're in the hospital now during the pandemic.
Sure. There's a little bit of confusion as to what's going on after the birth, but in New Jersey, I'm going to speak to New Jersey and New York, which is the area where we're in. We know that most hospitals are following the CDC and the AAP guidelines. That's the American Academy of Pediatrics. And what that's telling us is, first and foremost, parents are being tested when they're checking in for labor. So the birth parent and the companion are going to be tested. And if the birth parent tests positive but is asymptomatic, meaning the birth parent is not showing any symptoms, then the protocol would be for baby to stay in the room after the birth with the mother and continue to breastfeed as the baby needs it, making sure that the parent is washing her hands. And if there is a positive test, even if they're asymptomatic, they are suggesting that mom wear a mask while feeding the baby. And the partner can stay in the room, but they want the partner to be in full PPE. So in other words, full protective covering to make sure that there isn't any transmission. Now, if the mom is showing symptoms, then they are asking the mom to pump and provide the breast milk so that the partner can feed the baby during the hospital stay. For vaginal births, parents and baby are being discharged after 24 hours. And for surgical births, they're being discharged after 48 hours. Now, this is important, as we have discussed before, right? Because this means there's going to be less time where there's going to be support and checking in on the baby. Before the pandemic, we were seeing moms in the hospital for 48 hours if they had a vaginal birth and for 72 hours if they had a surgical birth. So all the more important why they need to get in to see the pediatrician and get into you as soon as possible after the discharge. Which brings me to a question. What's the timeline that you want to see newborns after the birth?
So that's a great question. I would like to see every newborn that is well and healthy 2 to 3 days after they leave the hospital. However, if your baby has any sort of issue or complication, if the pediatricians of the hospital say, I'm worried about jaundice, or I'm worried about hydration, or anything else, we can and will and should see the baby right after the hospital, the very next day, so that we can follow real closely what's going on and make sure the weight is where it should be and that there's not too much jaundice or bilirubin. So let's get that done. That's super important in terms of the health of the baby. And also, I feel like moms in the beginning really need a lot of support, not only from lactation consultants like yourself, but they do need professional support where we can say, yes, you're doing this right, or let's tweak this a little bit so we can work better for you.
Absolutely agree.
Yep. So hold on, my notes just closed. Okay. So our next topic is, oh yes, I get this question all the time, Rebecca. What's your opinion about grandparents and seeing the baby and when it's safe to see the baby?
I hope there are no grandparents watching us.
They're gonna not like us, right?
That's right. I mean, we've talked about this, right? This is a really tough one because who doesn't want to see a newborn, and especially if it's your own child's baby? So this is really one that's very charged with emotion and a lot of big, strong feelings. But the guidelines that are coming out are really protective, not just of the new baby that is vulnerable, but also mostly protective of the grandparents, right? Because they fall into the category of being at higher risk. So I think currently what's being suggested is that there should be, if the test results come back negative during the hospital stay, then there's more opportunity as long as the grandparents have truly sheltered in place and haven't exposed themselves to have a reunion much sooner. What are your thoughts about this?
So I want to go back a little bit before I answer that question. So in the hospital, if mom tests COVID positive, they have to test the baby.
Right.
The baby has to be tested at 24 and 48 hours.
8 hours, that's right.
So once the baby is negative, hopefully if the baby's negative and the mom is also negative, then when they go home, they cannot see their grandparents for 2 weeks. Why? Because they were exposed. They were in a hospital setting. We want to protect the grandparents in this case. Okay, it's not about the grandparents exposing them, but the other way around.
Right.
After 2 weeks, if mom and baby were never positive, so if everyone is negative and the grandparents have not been exposed to anyone sick, after 2 weeks, if they want to see the baby, they can, but still they have to wear masks. Right. Grandparents and parents, they have to wash hands a lot. And if it's possible to see each other outside on a beautiful day in a stroller, that's much better than coming into the house. So yes, so parents, new parents, will you get the same support you've always had from grandparents? I'm afraid it's not possible during the pandemic. It's not recommended, okay? We're all used to having mom come and take care of us after the birth, but we can't right now. But if it's been 2 full weeks and it's a beautiful day and everyone's wearing masks, can you see each other, outside where it's not crowded? I think that's okay. We don't want to deprive grandparents too much. Again, this is just my opinion. It is not some medically, experimentally tested thing that I'm telling you. It just happens to be my opinion and what I'm telling my patients at this point. So how can we deal with all of the issues parents are having during this pandemic? And the answer, to be honest, at this point is I'm available to see all well patients in my office because I'm not seeing anyone sick in my office. All the sick patients that call us, and we have plenty of those, we're seeing them virtually via televisit only. So we're keeping our office sparkling clean, using lots of Lysol and Clorox. We're all wearing PPE, and all parents must wear a mask if they come to the office. And newborns can come with two parents, but everyone else, we're asking that they only bring one parent with them, no grandparents, none of the other fun stuff we used to do where we would meet the whole family on the first visit. It'd be 3 people or 4 people in the room. It would be a great interaction. We can't do that right now, but I can't wait to do that again. That's my favorite part of doing pediatrics, is to meet everyone. But please, if the take-home point is anything today, is that we're here. If you have a question or a concern, and you can call, we'll see you virtually if you need a Progressive Pediatrics. But if you have a newborn, we must see you in person, weigh the baby, check the baby ourselves. And Rebecca, what do you have for support?
So I am offering as well telehealth at this time. The lactation consultants are currently not doing, in our state, are not doing in-person visits for obvious reasons. We want to protect the parents from any exposure we might have. And so I'm doing telehealth for prenatal consultation, first-time mom or mom that had some difficulties in the prior experience. I'm also doing initial consultations for feeding, not just for parents that choose to breastfeed, but for infants that are feeding formula, for the safe preparation, for bottle feeding, combination, pumping, any kind of support that parents need around infant feeding is being provided through telehealth. And most insurance companies are actually covering lactation at this time through telehealth. I'm in network with Aetna, so that's much easier for the patients that have Aetna. I bill them directly. And starting next Friday, I will be doing a group postpartum support for moms with newborns. So all of that information will be on my website this weekend. And I did want to say, as my last parting point, is that I appreciate so much something that you said at the very beginning of our conversation. And because I think it's so important, I waited till the end to highlight it. And that is that you talked about active feeding, which is so important and so different than the baby just being latched. Such an important point that oftentimes parents are not told the differentiation between a baby just being on the breast, right? It's very different. You can have a baby latched on the breast for an hour and nothing's going on but a nap. So I appreciate that that's something that you tell your parents, because it's so important to note the difference between a baby that's really actively feeding. So I thought that point was so great. I wanted us to kind of come full circle and for that to be the last thing that I shared with parents.
Thanks. Rebecca, that's great news about your postpartum support group. But what about parents who want to know how to breastfeed before they have the baby? Are there any virtual breastfeeding classes you know of?
Yes, there are. I will be putting the information about all of my colleagues' availability for group classes, and there are individual sessions that are available. I am doing them. In fact, I have 2 scheduled today, and I had 1 scheduled yesterday. And the good news is that specifically for Aetna, since I'm in network, I can speak more directly about them. They do cover 1 prenatal class. So I've been doing individual classes with breast exams, with individualized plans, teaching moms how to put the pumps together beforehand. So I do strongly recommend that, especially if it's your first time trying to breastfeed or your first time having a baby, that you get in touch with a local lactation consultant. And I will this weekend have resources up on my website, thelactationplace.com. Where you can have information about not just my services, but all of the other availability in the area, so that parents have the resources available.
Excellent, excellent. Remind me to link to your website. Also, I just want to say one last thing is at Progressive Pediatrics, as well as what Rebecca was saying at the Lactation Place, we want you to understand that we are supporting all parents, not only breastfeeding parents. So parents that come to see me in my practice, I will not push you to breastfeed if that's not what you want to do. But if that's what you want to do, I will support you. And I have resources like Rebecca that can help support you as well. So if you choose to bottle feed, please understand that I will totally support you and help you figure that out as well. So have a great day. We loved talking to you today. And Progressive Pediatrics and the Lactation Place are here for all New Jersey parents and New York parents if they'd like to
That's
access
right.
us, to help with all of this new way of practicing medicine and healthcare during this pandemic. Have a great day and don't hesitate to contact us. You can email us or you can even, chat with us on Facebook and have a
That's
great
right.
day.
Thank
Bye-bye.
you. Take care. Bye-bye.
Bye.